I believe that the Florida Health Justice Project is making a difference for Floridians. And one way that that happens is through the Stories Project website. And as the Stories Project webmaster, I have seen firsthand how what we do can positively impact the lives of Floridians. Now, funny enough, my relationship with FHJP actually began with my wife, Maralia Arroyo. She began working with the organization shortly after it started. It was through Morale that I learned how truly committed each team member is to ensuring that all Floridians have access to healthcare. It was during the summer of 2020 that I decided to join the team and lend my talents as a multimedia specialist. And the reason why I joined the team was because I truly feel that in this country, we cannot have health justice without racial justice. And we can't have racial justice without health justice. With the Stories Project, we work with storytellers on a variety of health justice issues, like elder health issues, long-term care issues, immigrant barriers to care, as well as people impacted by COVID-19. We also share the stories of those on Medicaid, and we show how important Medicaid is to these vulnerable Floridians and their family members. And because Florida has not expanded Medicaid, most stories are about people sharing what it's like to live without healthcare coverage. We hear from older Floridians, working parents, people struggling with illness and disabilities. Their stories are just so powerful. And the person on our team who works tirelessly to ensure that these type of stories get told is Blanca Mesa. Blanca is simply incredible. She's a public benefits lawyer, a journalist, and an incredibly effective advocate for Florida's most vulnerable. Blanca has been with FHJP from the beginning. One of her many functions is to interview the folks who contact us through our website or who are referred to us. Blanca talks to them about whether they would like to share their story. And she also explains why their story is so important and must be told. As Story Project team members, Blanca and I have read through every story. Many of them make you want to scream. Others make you want to simply cry. These stories are describing how people's lives are being shattered because Florida has not expanded Medicaid. Blanca and I hope you take some time. Take some time to go to the Stories Project website and read about the stories of these people who are struggling because they cannot access the healthcare that they in some cases so desperately need. And after you finish reading their stories, we hope that you decide to help support FHJP's advocacy efforts.
It's true. Many lives have been shattered, and their stories are heartbreaking, but their stories must be told. Florida Health Justice Project collaborates with storytellers on health justice issues like Medicaid expansion. We share stories to bring out the humanity behind the statistics. We tell the stories of those left behind, the neglected, the uninsured, those who are in pain, and those who scavenge to find life-saving medication. For some, sharing their story is a great relief. For others, retelling is reliving a trauma. But for all, it's empowering. It's a way for them to help others. And things can get better if Medicaid is expanded, if mental health services are provided, if homebound seniors get the care they need. First, Florida officials need to understand Floridians are struggling without access to affordable health care. Stories can bring that to light. I also spend a lot of time working with news media who are covering health justice issues, and that helps us amplify our work. A recent Washington Post story on Medicaid expansion featured two of our storytellers. One is Kelly Percival, an older worker who lost her job and then lost her health insurance, just as she was trying to recover from an injury. A second one is Michael Smith, a younger worker with asthma and no health insurance, who's forced to buy inhalers on social media marketplaces. These are two hardworking Floridians whose life would be much better if Florida expanded Medicaid. Sometimes people don't want to share their stories. They may feel embarrassed or ashamed to be seen in their darkest moment, but that's okay because Florida Health Justice Project helps them too. We provide the resources they may need, including information on where to find low-cost or free health clinics or food and housing assistance. And that has been a lifeline to many during the COVID pandemic because so many Floridians suddenly found themselves without a job, hungry, and on the brink of homelessness, with no idea how to access the safety net system. And we have been there for them as well. I urge you to continue to support Florida Health Justice Project and our work, which is vital to the future of Florida. Thank you.